So I'd like to welcome this morning Dr. Nemat Shafik from the International Monetary Fund. She's Deputy Director there, and she's joining us to talk a little bit about healthcare reform that she's seen across different countries. Thank you and welcome, Nemat.
Thank you. It's a pleasure to be here.
The IMF produced a very interesting book last year, which was a sort of look around different countries and to spot trends in healthcare reforms. What were the main messages coming out of that book, really, that you think are useful for the UK?
Well, I think the first message is really that the fiscal challenges facing the advanced economies, and including the UK, will be the dominant economic issue for at least a decade. That if you look at what's happened to public debt levels, they've reached levels we haven't seen since World War II, and getting those down in a reasonable fashion will dominate economic life for quite a while. When you look within the budgets of most of the advanced economies, the thing that strikes you the most is that the biggest driver of growing spend is the health sector. You know, we all talk about pension reform and pensions being an increasing pressure with aging societies. We think pensions will grow by about 1% of GDP between now and 2030. Healthcare costs will grow by 3% of GDP, so 3 times more than pension spending. So really, no country can get to grips with its debt and fiscal situation without getting to grips with healthcare.
And do you see any country being excessively successful in trying to manage that, their productivity, for example, to bend the cost curve? What lessons can we draw from some of the countries that the IMF have been looking at?
Well, healthcare systems are so complex, and we're not health experts, but what we observe is very different patterns across countries. And some countries have been able to deliver pretty decent health outcomes and contain costs at the same time. And they do it in very different ways, but the countries like Sweden or Germany or Japan or Italy have pretty good health outcomes and have levels of spending which are not excessive. There are obviously different elements of success in terms of how they've done that. Some have used budget caps, some have used private provision, some have used competition. And I think given the importance of this issue, it really behooves everyone who's in this sector to be looking out and across and trying to pick up the elements of successful reforms from elsewhere.
And is there any one message out of that you might be giving the UK government when looking at the NHS? Or really are you asking them to just reflect on the range of policies that you see?
I think we would say, look at the range of policies, look at the options. The NHS has been incredibly successful in many areas, but the issue about the trajectory of future spending is really difficult. And unless the UK is able, over the medium term, to bring that spending down, it will be to bring the cost curve down. It will be very hard to sustain the strengths of the NHS. I think the hopeful message is that we don't think there's a trade-off between spend and health outcomes. There are many ways to square that circle. I'm not saying it's easy, but it doesn't. Containing costs does not necessarily mean that people will be less healthy. And the real challenge is to find those solutions and ways to make the system work that will be able to achieve both those outcomes.
We were hearing this morning at the summit from Mark Pearson from the OECD, and one of the things he said was a lot of countries who are in a crisis are centralising, particularly in healthcare, in order to make some fast decisions. Clearly, we are a pretty centralist system, so we've got a benefit in that respect. But one of the areas where we've tried to make some changes is in the area of pay, which is 70% of our bill in the NHS. How do you think, are there any useful lessons from elsewhere on how not just to cut the pay bill or cut staff, but how to do it in a sustainable fashion that can, where productivity is enhanced?
Well, I mean, we have some sympathy for single-payer systems. We think that single-payer systems are quite good at delivering cost efficiency and achieving equity as well. So, in terms of our advice to many emerging economies who are building up their systems, we tend to encourage single-payer rather than multiple-payer systems that hold those purse strings centrally in order to keep costs under control. So you're right, in that sense, the NHS is in a stronger initial position. The issue of pay is very, very difficult. We like to look at the issue of pay relative to productivity. So it isn't an absolute level of pay that we talk about, but how does it relate to productivity? And so the key question is how to increase the productivity of workers in the NHS, be they doctors or nurses or administrators. And the more we increase the productivity, the more scope there is for pay increases. Clearly, the countries that have been under distress in Europe, for example, have had to cut pay. And some of those cuts have been quite tough. They've also had to cut pharmaceutical prices and how much they're willing to pay for drugs. In that sense, too, the NHS is a little bit of a model. You know, one of the things we looked at when we were advising Greece was how much Greece is paying for medicines relative to the NHS, and we found quite a huge gap. They were paying far more. So using the NHS as a little bit of a benchmark of efficient procurement of medicines. But really one has to look at the pay issue in the round. It buys you time to contain pay, but the really long-term gains are in the productivity of workers in the NHS. So pay is part of the solution in the short term, but it isn't the long-term solution.
Given all that you've said about the reforms you've seen in different countries and looking again at the UK, it sounds as if you might be quite hopeful about the things we have in place to try and help ourselves in the next few years. But are there any particular areas where you think really could do better, that we really should be motoring on that we're not?
You know, I think the issues around competition and finding ways to introduce more competition in the system would certainly help, both in terms of efficiency and also just providing more information to a single payer as to where services are being best delivered and to transmit good practice around the system. So I think that's one area where one could see perhaps a bit more. But really, you know, as I said earlier, we're not health experts. We don't have strong views on the specifics of the system, but what we observe is this ability for different systems to deliver different outcomes with different costs. And I think the people who are experts in this field would do well to look out as well as in. I know healthcare reform is an intensely complex subject, and people who work on these systems can get very quickly, you know, dive into the complexity and maybe lose sight of some of the opportunities and ideas that are elsewhere. So I hope that's something that we at the IMF can bring to this debate, is to at least point to these differences, and hopefully the experts will find solutions among them.
Dr. Nemat Shafik, thank you so much for spending the time with us today.
Thank you very much. It's been a pleasure.